Hello, I'm Julianne Good, and this is Psych One-on-One. Welcome. We are here to make psychology more understandable with tips for you, your family, and friends to make your lives easier. Welcome to the evening. We are in downtown LA, and it is a nice 72 degrees here, so I hope you're keeping warm in your part of the world. Tonight, my special guest is Dr. Trevor Daniels, and we are going to be talking about Black psychology and Black psychologists. So welcome. How are you?
I'm doing well. Thanks for having me. How are you?
I'm doing fantastic. Yes.
Good.
Yeah. So can you give the listening audience a little bit about your background?
Well, I am trained as a community psychologist, clinically trained. I have done a lot of work with diverse communities, pretty much substance abuse, HIV/AIDS, that type of thing. For the last 12 years, I've been teaching graduate school. This is the first, perhaps time I haven't really, taught in a while. So this academic year, I'm taking a break, just to, sort of build my own things and, seeing what's out there, what, new opportunities, things like that.
Yeah, wonderful. Thanks. And it's good to have you back, too, because I had you on last year and when we were at the old studio for Skid Row Studios. So nice to have you back. Yeah. So what is the importance about talking about Black psychology and Black psychologists this evening?
Well, if you remember when we talked last time, we were talking about, police violence and just what seemed to be an upsurge in Black communities of color. And when we spoke, I sort of talked about this idea that, there is a context, for all of this stuff. And so when you talk about Black psychologists, Black psychology, we're really talking about paying respect to the context in which people live. Unfortunately, there are not a lot of Black psychologists out there, and you'll hear in places, academic institutions, people who are studying now, this need for a lot of Black male, therapists in general, especially a lot of Black male psychologists. But when you think about the idea that we all exist in some type of context, and we carry that context with us when we are out, interacting with the world, it's sort of important when it comes to mental health issues, when it comes to community violence and, all these other ills that are affecting different communities, that there are people who understand that context and can provide services within that context. So that's why it's important to talk about it.
Yeah, definitely, especially for all the newsworthy items that have been in place lately. I think this is really important that we're talking about this evening, because I think a lot of people don't understand exactly what's going on with the Black community and, all the different, like you said, all the different contexts of it, all the, there's so many different aspects of it. So what makes it tricky to be, working within that context?
Well, what makes it tricky is if you talk to people who are not socially justice-minded or who are not multiculturally competent, there's sort of this idea that, if you are trained in mental health, if you are a psychologist, then you can work with anyone. That's only partly true.
Right.
Because there is a context and, just to, sort of add a context to it, there's this study out by it's Demographics of the U.S. Psychology Workforce. It's finding from the American Community Survey, and they did this work from 2005 to 2013. And what they looked at were the demographics for psychologists in the United States. Now, there are a lot of statistics. I won't go through them all. But what I will point out is that, yes, there was an increase in the number of minorities who became psychologists.
That's fantastic.
Yeah, and they started defining psychologist as anyone coded with a doctorate degree, which is sort of tricky in and of itself. And, as you go through the report, they sort of tease that out a little bit. But so it increased by 100%, the number of Blacks or African Americans who are psychologists. However, when you look at the simple numbers, it's sort of alarming because there were like 84,000 psychologists across the country. and only 2,000 of those were Black people.
Wow.
And then that increased by 100%, which made it a little over, 4,000. So really not a lot when you're talking about 84,000 people across the country, who are psychologists. When you're talking about only 1%, of the population who holds a doctorate degree, only 4,000 of those people, were Black. So
yeah, and why would you say that? What are some of the elements that come into play that there aren't enough Black students going into the program? And I know when I was going through my MFT program at the Chicago school, there were very few of my fellow students who were also Black. So, so I was always kind of wondering what elements went into that. Do you know?
Well, it's hard to say. And one of the things that the report, points out is that is an area where there needs to be more study. I know anecdotally for myself, I did an MFT program and then, did a 4-year doctoral program right after. In my MFT program, I think I was the only Black person, in my cohort. And then when I went to get my doctorate degree, there were 4 of us, and one we didn't see, like halfway through first semester, she left and didn't come back. Some people have work obligations, some people have family obligations. What I've learned from, the students that I had in the last couple of years, especially the minority ones, is that a lot of them don't feel, welcome in programs. They don't feel like the programs are speaking, to minority issues as they should. One student that I had recently, African-American female, early 20s, had an experience where one of the program administrators, said something to her on the meet and greet date that was really racist.
Oh, no.
And that she didn't, say anything most of the semester, but as we got into, the coursework, and I was teaching this course, Intercultural Process and Human Diversity, where she finally started to talk about how this person came up and said, whatever she said to her, and, and thought it was funny. And the student was very disturbed, and was wondering, is this really the place for me? So, there are a lot of different reasons why people of color, either don't go into programs or drop out of programs. Sadly, I don't think it's studied that much. But that's an area where we need to do a lot more research.
That would be a good thing to research because as you said, there are specialty populations out there, no matter what culture, and it is so much easier for the client or the patient to come to a counselor or therapist that is of their own race, period. It's just so much easier, especially, cultural context, language. There's so many variations of that. And like you said, it's just one therapist does not fit all.
Right.
Or it's going to be a little clunky at parts. So.
Yeah. And it's important to be careful. And, for your listeners, it's important to, understand that what I'm not saying, or I don't think what any culturally competent person is saying, is that, a Black person only can be helped by a Black therapist.
Right.
But, it's about people finding, others who look like them, who understand the context, who are aware of their own, biases, and who can make intelligent and culturally relevant interventions. It's about that. And it's about, having that available for people. And not this, sort of ethnocentric monoculturalism, type thing where, the dominant view is the guidepost for everybody, and and we're all equal, and we should all live this way and think this way, and and present ourselves this way.
Yeah, we're not quite there yet.
Right.
Yeah, no. Exactly. Yeah. I know. I mean, there's, we all have good wishes that eventually that happens, but it seems for the steps that we take forward as a culture, then we end up taking baby steps back, and sometimes violent baby steps back also. So it's really difficult to, get to that point.
Mm-hmm. It is. And I think, well, here's an anecdotal thing. So, before we started the show tonight, we were, sort of talking about the quality of programs and, how, it just seems to, be going down. Well, at a lot of schools and programs across the board, you have this, student as consumer, type thing. Not that that's necessarily bad, but, sometimes, you get this dynamic where it seems like students are running the programs. They're dictating what courses are being taught. And I know when it comes to diversity and multiculturalism, that's a scary topic for people. People, have this sense that we're trying to tell them, who they should be and what they should think. And it's really not that at all. What we're saying is you have to be aware of the way that you think and the impact, that has on people. And so you talk about taking 3 steps, forward and, 10 steps back. New students, especially the younger ones who don't have, the history or knowledge of, civil rights movements, whose parents may be, sort of on the younger side, you tell them or you suggest to them that, the world does not start to exist when your eyes pop open in the morning.
Right.
And they take that, somewhere completely different. You're telling me I'm inauthentic, I'm this, I'm that. And what we're really saying is what you think of yourself, perhaps only you were thinking it, and people are thinking something different. And no matter what you do, people still may have different thoughts of you. Mm-hmm. And, to be aware of that when you go into clinical work, especially with people who have had these, traumatic experiences because of their difference. You have to be prepared for the fact that no matter how much you say, you're there to help them, they may be thinking something different about you. Mm-hmm. So it's, that triggers people and, and they just don't want to look at, their own biases and, and then we get into complaints and, you've been in school and you get the students who, they're going to sue the program because the program is racist. The professor has an agenda, especially if they're Black and male. It's crazy.
It's crazy. I know. I had a little bit of issues in my cohort too that ended up happening where there could have been more sensitivity that was instilled into the situation. Mm-hmm. And it made, what may have been a misunderstanding, it blew it up to the next level, and of course, if the student got emotional about it and then really took it to the next level and started telling other people about it, then you have a whole different ball game with working with that. So when you're teaching your students about diversity, where do you like to start from?
Well, it's interesting. This course that I taught, it was a coordinated course, so I didn't create it myself. I actually took the course when I went, because I was teaching in a program where I graduated from. So I took the course. It was drastically different by the time I was teaching it, and it changed, over the 8 years that I worked, with the program. And the person who coordinated the course, for a year and a half or so, extensively studied, how to teach diversity. And you really have to prepare, people for, this dialogue. Mm-hmm. When I was a student, it was sort of arcane. This is what the Black people do. And, then we're going to have a week on the Native Americans.
The Sue and Sue book. Oh, yeah. I remember that book. I just loved it.
Yeah. And, and when I was in my master's program, it was even worse. And, when I was, an undergraduate student at Miami University, where the minority population was like 2% out of the entire student body. And that's, inclusive of everyone. We really didn't even talk about serious issues. So you really have to, prepare people. You have to, and, I don't want to give a, psychology lesson, to your readers, but, preparation and really having people understand, what diversity is all about. Mm-hmm. And it's not, this idea that it's not kumbaya rainbows, things like that. It's, about understanding context, understanding one's own biases.
Right.
Understanding that you project something onto the world, understanding that, your identity was comprised, from all of these different experiences that you've had, what you've been told about the world, what you've experienced in the world, things that your parents taught you, all of that. And you take that information and you create this identity, and then you go out into the world and you project that onto other people. And a lot of it is outside of conscious awareness.
Oh, yes. It's a lot of it is nonverbal.
Yeah.
And a therapist, I mean, when you're in dialogue with a patient or a client, sometimes a lot of times you're not even aware of what your nonverbals are saying until you look at the other person, and all of a sudden they seem uncomfortable and stuff, and it's like, okay, what did I put out without even saying it? It's a little scary because there's so many different types of communication at play that we all have to be aware of when we are sitting and trying to help people that are not of our race.
Right. And, and the one thing that I always do, for myself and I always suggest to other people is, insight and awareness. What is sort of happening with me as I'm engaging, with this other person? What am I thinking? What am I becoming aware of? How am I feeling? So there's a lot of introspective work that people, need to be doing. I remember this student always comes to my mind, and, I was looking on one of the social media things, and I see that he's graduated, he's a doctor now, and I remember having him first year, and, he's saying, I'm very open to everybody, and I have all different types of friends, and I had them do this exercise. And when he came back to class the next week, he was literally in tears in class. I looked at this, and all of my friends are the same. We all sort of think the same. And now I'm sort of wondering whether or not, I'm fit to be a psychologist. And it's like, well, hold on. Don't spaz out too much. The goal is to get you to, to sort of be, expansive in how you think, about others and how you think about the world, and, and allow some space for other people to be who they are, regardless of how you think about yourself and, and the world itself. So I'm glad that he, made it through that process. But yeah, it's, you have to broaden your horizons and really understand that, there is uniqueness in the world.
Oh, yeah. Yeah. And it's wonderful. I think, a long time ago, I was working at a domestic violence shelter. And I think probably one of the most interesting clients I worked with came in with her baby daughter. Now, this is an emergency shelter. So typically we were having people stay with us for 30 days. This woman was from Bhutan, I believe, and very different from any other person that I have ever met. And we had a little bit of communication problems, but she had this beautiful heart and just this willingness to communicate. So I would sit with her and just talk and just be with her and play with her daughter. And that alone was really healing for her, for somebody to just sit and listen to her. And then she was telling me stories about her homeland and how she ended up coming over to the States and the abuse that she went through in her country. And it's, different cultural standards. And, some of the stories just made me want to cry, but I just what a strong woman for making it through, not only where she was, but coming over to a whole different foreign country and setting up roots here.
Right.
Was incredible. She taught me so much. But I had to be open to learning. I had to ask her questions. And sometimes I would ask questions and I probably thought, this probably sounds really stupid once I think about it. But, so I was a little bit embarrassed. She was okay with it. Right. And, we learned to communicate with each other.
Mm-hmm. Mm-hmm. Yeah, it's interesting because I used to train. I used to work for a very large social service agency that dealt with women and children in the child welfare system, and the mothers were usually, drug addicted or had some, type of problems with substances, and very large staff, and so I was training there, and then also, with my students, and my one argument was, you can tell me any type of intervention, for anything. Mm-hmm. But do you actually know, why you're using it? Do you know when it's appropriate to use it or not? And most people couldn't tell you that. And so what students seem to be concerned with, or with very rigid, therapists, psychologists seem to be concerned with, is just the intervention. Mm-hmm. But again, we're talking about context. And so some of those things that we may, deem stupid, the stupid question, maybe I'm not doing enough in therapy because I'm playing with the little daughter instead of, filling out a form or asking questions, sometimes maybe that's just what people need. Yeah. There's a context to all of this. So, you have to remain open. You have to allow yourself to be open. And I'm not saying that, interventions and theories are, obsolete or we should throw them by the wayside, but they need to have utility.
Exactly. Yeah. I know that's, the deeper I get into my career, I understand that too. And I was trying to kind of explain that to my fellow clinicians today who are much younger than I am. Mm-hmm. You can know all the theories in the world, but you have to know how to practically apply them, right? Because otherwise you lose people in psychobabble, and they shut down because especially if their intelligence level is at a different, different level than yours is, then, you're going to have problems. You're going to have issues. So it's like, no, just reel it back and use real language. I think that's really important because I think no matter who you have in front of you, you have to have them start rebuilding trust, because that seems to be across the board, is that people come to us for help because they've lost hope and they've lost trust and they've lost faith.
Right. Yeah. I remember when I was, in the doctoral program, and I was talking to, one of my fellow African-American, cohort members, and, she was talking about, another person, and, and she was, I think, there was he liked her or something, and, and she was saying, he's always trying to, show me how brilliant, he is. And she said, we're all brilliant. We got into a doctoral program. We're all brilliant. And so, what I say to the students is, I really get unimpressed by how much of the theory you know, because you have to know that to graduate. And if you don't know it, it's going to be obvious. But the question is, can you apply it? Do you know when to use it? Do you know how to use bits and pieces? Can you tell me why you should not be using this intervention, at this particular time? Can you demonstrate for me that you can, understand these people in context and maybe do something that's a little unconventional because it fits within the person's, culture, their values, their customs, that type of thing. And if you can't do that, you're not ready to work with people. But programs are, graduating people all the time, who can sit down and rattle off, the theories and, and the interventions.
I'll show you a few people.
Right. But, they just don't know when to use them.
I know. And it's just weird because it just sounds... To me, it sounds like they're opening up a textbook and reading a page out of it, or they're trying to impress somebody. And I'm not I'm not knocking down the theories and stuff because they have relevance. But you're right. They, it's a nuance. Yeah. It's knowing when to use what at what time. That's it. And it's just, I think it's so important, to our listeners, that if you are going in for therapy, the first session, at least the first session or two, should be assessment. It should be a lot of questions that are being asked. If your therapist is not asking them and you feel it's really important information, by all means share it,
Right.
or write down a list before you go, because of course, everybody during their first therapy session is going to be nervous.
Right. And here's a good example. Well, one, I always tell people, looking for a therapist is like shopping for shoes. You have to try to fit. Don't let money, guide all of your decision, although, it's a big determinant. But, the example is, so there was a student, who talked about, I presented this case, to a class, and there was this girl who was living, one of the, rougher neighborhoods, in Los Angeles. She was adolescent, preteen. And on her way to school, there were some guys in the, hanging around the apartment complex who'd make lewd comments, things that would really, sort of constitute, child endangerment or harassment, those types of things, child abuse, stuff like that of a sexual nature. And so, the student said, well, you got to call DCFS, call the police, And I said, okay, so now these people are going to, retaliate against the whole family. So, maybe people are going to get killed, beaten up, things like that, because, this neighborhood was high violence, crime, gangs, drugs, that type of thing. And it's just like, one, there's something that you have to do as a professional, to protect a child, because a child, is potentially in danger. But you also have to weigh, what your actions, what the response is going to be. And so, by off the cuff, just calling the police, DCFS, now you've opened up this family to potential, harm. And so, at the end of the exercise, we were able to talk about how, perhaps, and I'm not saying don't call DCFS or don't call the police, but perhaps an intervention before you do that is to have some older male, cousins or family members or trusted friends, walk the person, to school, pick them up, what have you, which was, part of the intervention, and because this was a real case. And once we did that, the harassment stopped. And there were other things that happened, afterward, in terms of authorities. But the idea is you have to consider the context. I've done therapy, in people's homes, where outside of the house, people were getting shot and killed, gang fights. And so I'm trying to have a group therapy, and now we have to lay on the floor.
Oh, scary.
What's going to happen when I show up? I had one client, who would stand, they knew what day I came, and, older woman, she would stand outside the house. Oh, the doctor's here. Once she stopped doing that, people stopped, sort of looking at me every time I showed up. Who is this person, driving a nice car? Is it someone who's trying to encroach, upon our territory? Is the police or whatever?
Right.
So, the way in which we practice really has to, speak to the environment in which we practice and to the people that we are providing services for.
And be respectful of the environment that we practice in.
Right. Absolutely.
Yeah. While being safe and, watching out for our own safety. I've known quite a few therapists who have done home visits, and they told me how dangerous it could be in some of the neighborhoods. And, I'm pretty sure that the general public doesn't know that.
Right.
They think that we're all in, offices in Beverly Hills. And
right. No.
Not yet. No,
Not yet.
But, it's we have to work in the trenches sometimes. It's just, it can be dangerous.
Yeah. And, most students, or at least the ones I've encountered, their ultimate, aspiration is the office in Beverly Hills. But I, am of the mind that, people need to be out in the trenches to be, adequately trained, plain and simple.
Right. I mean, it's life. You have to get in there and dig and be able to put yourself through those challenges.
Yeah.
Because, you never know who is going to present in front of you and need help.
Right. So I would say that, a good 90% of all students that I've ever taught that were from LA had never been to like South LA, or East LA, if they were Hispanic, West LA, that was their paradigm. And the ultimate goal is, the office in Beverly Hills. They've never been to any of these places, don't know anything about the people, and then they go get a job at DMH.
Which is Department of Mental Health.
The Department of Mental Health, where they are probably seeing, maybe 80-85% indigent clients who are from these areas. And they don't know anything about them, have had no training, whatsoever.
Yeah, I just had a psychologist on recently, and she said that they were, placing students into practicum, and students were coming back and going, "What did you do to me?" Because they were in tears. They were just like, they were in shock. And what do I do? What do I do with this population? I haven't had enough training. I didn't learn about this in the classroom, or it just wasn't discussed enough, I guess.
Yeah. Well, it depends on, again, a lot of different things. I think I know who you're talking about. Some programs... programs talk about, we are socially justice minded. We, are big on diversity, but then when you get there, sort of diversity light, it's really not diverse at all. And, God forbid that a student gets triggered because, you touch upon a sore spot. So, they may be correct. They may not have had the training. I know for the intercultural class that I used to, teach with 7 other people, the students came in thinking it was sort of a fluff course. They wouldn't read the material. They didn't really take it seriously. And to this day, I still get calls from former students who are in training now or, who have, just graduated, who need some type of assistance. This is what's going on. What do I do? And it's just like, I helped them out, but it's like, remember, that class when you didn't read the work? And
maybe you should pull out that textbook that you didn't read in the first place. Or at least look at some of the references and start doing some research as to, if you have a person of a different culture that you feel that you don't have enough training for, you really need to go and do the research. Yeah, I had to do that with a recent client who was from Cambodia. And go and dig a little bit and stuff. And it was fascinating. I was, he was a really good client to work with. So, it's just, again, just getting comfortable and realizing that we're really here to help.
Yeah, and that's something that we all have to do, whether you are socially justice minded or culturally competent, or not. That's something that we all have to do. I have a friend. I'm from Ohio and he's from Detroit, and he talks about, just how great, LA is. And, I have to remember he's from Detroit, where the city government stole all the money. And, and he talks about how, I think it's Halloween or something, they burned down the houses and, so a completely different context.
Yes.
And he's African-American as well. And so although we are both identify as African-American, his context is so much different than mine, that if I were working with him as a client or, people, from that area, I would really have to do a lot of work to understand, the dynamics of what it means, to be African-American and male, in that context. So, again, it's not... if you are, Black or a person of color, that, we have it all wrapped up, we have it all solved. We still have to, do the study as well. we still have to be prepared. So, context is important.
Right. Mm-hmm. Yeah, I had two women in my cohort. One was from Sri Lanka and one was from Chicago, both African-American women and completely different worlds. Mm-hmm. It was fascinating to watch them interact between each other because it was just...
Yeah.
It was almost like two different languages because they had grown up so differently. Mm-hmm, mm-hmm. It was fascinating.
Right. And, and so we talk about the difference between people, but what about when in someone's head, the connection, isn't sort of being made. And so I think about this student when I was in my master's program. She was from India, and she was in the lowest caste system in India. And then she moved to California and married this black man. And she swore up and down that in her entire life, she had never experienced any type of discrimination, or racism. And it's just like, and this guy that she married was a politician and, and all this stuff. And it's just like, how? And I think at the time she was like late 40s, early 50s. It's just like, how, with that background, have you not ever, experienced any type of racism or discrimination? And so I was, sort of disturbed that, the professors never really picked up on this and, no one ever challenged her. I had a peer in my cohort, said, like maybe the first week of school, identified as white and was clearly, not white. Mm-hmm. I had a student who, talked about, not having told anyone in her family that she was in a doctoral program. Well, why? Because, they're going to think differently of me. Well, you're going to be different. What are they going to think, once you graduate and you start making, the 6-figure salary that everyone aspires to, and you have this different type of language. And, she just could not handle, the idea that was going to happen and, sort of fell apart, in class.
Oh, poor girl.
Another student who, had been abused by his father and was still being abused, who then came to class and projected that, on to me, and other, sort of strong, males who had strong personalities. So you get these people, all the time, and they want to step out into the world and help others. So it's easy, to talk about, the client and how difficult that is. But what about when you, are the difficult one?
Right.
And
in the
you
equation. Need therapy.
Yeah. Right.
Exactly. Mm-hmm. Exactly.
But you can't say that.
I know.
You cannot say that,
I don't understand that.
Can't say it.
I hope to see that change eventually.
Yeah.
Because in England, I do believe that you have to have 1 year of your own psychotherapy, and then you go before a board. At least this was at Tavistock Clinic when I went there for study abroad. And they were saying a board determines at that point whether or not you are psychologically fit to go and do schooling.
Oh, okay.
I think I would love to see that instituted in this country.
Yeah. Well, a lot of programs, I know mine certainly did, required that you went to psychotherapy. Mm-hmm. You had to graduate, but, beyond, what happened in psychotherapy, that didn't come into the equation. But, people had to go, but, I've run into a couple of people that's like, really?
And try to get around that, right? They didn't really want to know themselves.
Yeah.
That's not good.
Yeah. Only one time, when I first started the doctoral program, there was a student in our program who was commuting from one of the other campuses because they didn't have the classes that she needed. And she lasted like 2 weeks because she clearly, whatever we were talking about in class, it always ended up talking about her and her husband, who she was having, some problems with. And it's like, that's not even the topic, of discussion or the class. So some people, it's really apparent, that they are not ready or just not suitable. And others, it's not. It sort of creeps up on you. You sort of see things and you're like, well, maybe they're just having a bad day, or maybe, the topic of discussion was a little bit triggering. But, when you sort of start to look at people, the grand total of the person, it's just like, oh, boy, something's not right. I even had a student who, we would give assignments. And again, this is a coordinated course, and I would get different assignments back. And, I said, well, what's this? Well, I thought it would be better if, this type of assignment was assigned. So that's what I did.
I created my own assignment. Yeah. Here you go. Yeah. And try grading this.
And when I feel like, you give me some feedback that's worthy of me reading, then, I'll meet with you to talk about, my progress in the class. And this person has graduated, so.
Go figure, huh?
Go figure.
Well, Dr. Daniels, we are going to return after this break, okay?
Okay.
Therapy cable is the missing piece in the puzzling question, what is the role of the cyber world in healthcare? Therapy Cable has created a marketplace where healthcare finally meets technology in a consumer-friendly way. We use online technology to bring together various entities of healthcare in one central place. It's easy to access from any internet platform. We provide educational videos on topics like acupressure, medicine, psychotherapy, and yoga. You can confidentially use this information in the privacy of your home. You can stay connected to the provider of your choice or even see your provider in person. Get started today at therapycable.com. And welcome back to Psych One-on-One. This is Julianne Good, and I'm with Dr. Trevor Daniels this evening. We are talking about Black psychology and just the psychology field in general. I think it's kind of sprouted out here, and I think a lot of people don't understand what students go through and the sacrifices they make to get through the programs. I know I'm in my 8th year now, straight through from my bachelor's into my doctorate degree right now, and I have had to sacrifice quite a bit, especially for the master's program. And a lot of people do stop at their master's program because that seems to be just about the hardest part of the educational process is that 3 years. Now, it used to be 2 years, but for marriage and family therapy is now 3 years. And so that third year of education, people are, writing their papers and having to study for the comprehensive examinations and doing more extensive work and having to work in their practicum hours, and their practicum hours are not paid. It goes towards their licensing, but, so a lot of people have to also have like at least a part-time job on top of it and take out student loans. So there's so many components to having to get your psychology degree and your licensing, so I think, but that's really part of the process of maturing and really being able to sit with a client or a patient and get yourself out of the equation temporarily so that you can be of benefit and you are not putting your problems onto them, which is called countertransference.
Right.
So it's that delicate balance. And
well, what I will offer anybody who's a student and who's listening right now is, yes, money is always an issue. But, what I did, because I went to school, from the time I graduated high school, I went to school until I was 30 years old. Just straight through all psychology degrees, undergraduate, master's degree, doctorate degree, and actually 2 masters. And I always worked in the field. So, I always had, jobs, that sort of, helped with the education I was receiving. But when it came to, practicums, internships, I just simply would not apply for anything that was not paying. If it was $300 a month, I applied to it because every little bit helps. So that's what I will offer. But, in terms of, getting yourself out of the equation, I want to go back to something you just said, after the break. So we sort of started out talking about Black psychology, but it did sort of, sprout out. And I want to make it clear that, whether you're talking about, the white psychologist, the Black psychologist, the psychologist of color, we all need to be multiculturally competent, period. And, one of the reasons I wanted to talk about Black psychologists was because the numbers are just so small.
Yes, they are.
But really, we can have incompetent Black psychologists. Just because you're Black, doesn't mean that you understand all Black people or people of color or, the relevant issues. So, this is really a discussion for everyone. But, we talk about getting ourselves out of the equation. We talk about, practicing in a way in which we respect, the environment, the cultures, the values of the person that we're working with, And you heard me use this term ethnocentric monoculturalism earlier. And so that's sort of this idea that the values and beliefs and assumptions and practices of society are structured in a way that only the very small segment of society benefits. So if we are talking about, U.S. society, we're talking about, the WASP, white Anglo-Saxon Protestants, the males, they're the only ones who benefit. They hold all the power, they make all the decisions, they define reality for everybody. And if we, sort of look at that a little, further, we're talking about people who believe that they are superior. Their culture is superior, which inevitably means that everyone else is inferior. They can impose standards. A white psychologist in the program that I most recently, taught in, she said, well, what kind, she was, talking about me veiled. We didn't get along too well, but this veiled sort of, what kind of mental health, issues does a person have who, has graduated, 10 years ago and, and doesn't have a private practice. Well, who are you to define the reality of what one's career should be?
Right.
My career is just fine. Had a job at graduation. So what are you talking about?
And you get to decide where you want to go.
Yeah, and I can decide where I want to go.
Right.
But the idea is that, if you are not presenting yourself in the world as such, then you don't matter. There's something wrong with you. A psychologist in a program, that professes, diversity and social justice said that.
Right. And the whole thing too, more research oriented.
Mm-hmm.
Okay.
Yeah, absolutely.
That's a different, way different mindset for
Right.
psychologists who should be going into just mainly doing research and
Right.
people who are practicing and being with people and trying to help.
Mm-hmm. Mm-hmm.
And I have seen some people who, are coming in from the research end and trying to connect with people and just not making that connection.
Right.
So really
Because
just
the
belong in the
research
research
is,
world. Yeah, exactly. And hopefully somebody tells them along the line, maybe you'd be better off if you went that way.
Yeah. Yeah.
Choose more of that realm and stuff because, there's always more research to be done. This is
Right.
this is a soft science. We're always going to be changing. I mean, there are certain theories and ideas that will stand the test of time.
Mm-hmm.
Still, even some of Freud's theories are still relevant. But, things change with the society.
Right.
And
Right.
we do have a rapidly changing society. We do have more globalization. We do have more people that are going from different countries and transplanting for whatever reason, and having issues
Right.
because they're not back in their home turf.
Right.
And we need to have compassion with people for how courageous they have to be for all of the barriers that they've had to go through to be here.
Yeah, and one of the important thing is where one of the places where we need to start is that this ethnocentric monoculturalism manifests itself in all of the institutions.
Right.
That, serve as the foundations for our society.
Yes.
And so we have to start there. And so you mentioned Sue and Sue earlier, and a lot of people have issues with Sue and Sue's book. I think, I've read it 8, 9 times because I taught this class,
right.
And they came out with a new edition. If you really, look at what they're saying, they're giving suggestions. And so when we're talking about working with people from a multicultural perspective, we're talking about helping roles as process. So we're in a helping role, but what is the process? We need to, be expansive in our thinking. What we do with people need to be consistent with their life experiences and cultural values. So we all get depressed, but how we talk about that depression, whether you are, from one of the Hispanic cultures, whether you are African-American, Black, whether you are white, Asian, Pacific Islander, it may be completely different. And what one may do is completely different.
And depression can manifest in so many different ways. Mm-hmm. Like in a lot of cultures, it'll be physical symptoms.
Right.
Even if there's really nothing there, they've gone to their medical doctor, there's nothing wrong with them, they check out physically, and they still present. It's like going, oh, well, I have, a lot of times I get clients with, I have chest pain,
right.
Which a lot of times is held in grief. They just can't express it. It gets stuck right there.
Right. Or people are depressed about, some type of family dynamic, and you tell, the young Asian student, well, you need to stand up to your parents. You need to do X, Y, and Z.
That doesn't work.
Does not work for the large majority,
right.
of Asian identified individuals. And so there's this idea that there are individual, group, and universal dimensions of existence. And so we have to respect that, when we are working with clients. There are universal and cultural specific strategies. If someone, is, suffering from schizophrenia or something like that, okay, so medication, may be one thing, but then how does the family group, how does the community, deal with that type of thing? Individualism and collectivism. So we're talking about systems of ecology. We belong to a system. So I am working, with a particular client, and because they are going to change some type of way, inevitably the system that they are in is going to be altered as well. And so can we speak to that? And then, client systems, so that's multicultural counseling. But then when we talk about cultural competence, we bring it back to the practitioner, him or herself. So, what are my own, assumptions and biases and values?
Right.
And, how, are they juxtaposed against those of the client, that I'm working with? When are they getting in the way? Can I, sort of set them aside and allow, space, for the person to be who they are? I had one student who hated organized religion and, wrote in the paper, I just cringe every time I hear people say God and I'm going to pray and I just think these poor people. And I said, well, wait a minute. You can think whatever you want, but you have to allow the space for the person, to, have that part, of them come into your work with them, because that's going to be very important.
Right.
So you have to be aware of your assumptions. Now,
exactly. You have to be honest with yourself.
Yeah.
And we are going to wrap this up.
Yes.
Yes. So thank you so much for being on. If the listeners would like to contact you, how can they do that? They can reach me at Dr. T.A. Daniels at gmail.com. That's doctor spelled out. T as in Tom, A as in Alan, Daniels at gmail.com. And Daniels, correct? Correct. Excellent. Thank you so much, Dr. Daniels. It was just wonderful to have you on again. Well, thank you for having me. Yeah. And to the listeners, if you would like to contact me, you can do so at jgoode8@verizon.net. My office number is 562-209-1837. My office is located in Santa Ana, California. And please contact me if I can assist you in any way. You can contact me by Facebook or by Twitter. That would be wonderful to hear from you, and I'd love to hear your suggestions for future shows. I want you to be involved, and I want you to take care of yourself, take care of each other. Bye now.